Hello, everyone. I'm super duper excited tonight. Tonight, I'm going to be talking to a fertility doctor, and we're going to be talking about IVF. Tonight, we're talking to Dr. Ellen, and she's going to come on and share with us the answers to some of your questions. I posed the question yesterday, and some of you guys sent in some questions. So, Dr. Ellen is going to join me in just a second, and we're going to answer all of your questions about IVF. Let me add her to this conversation. Let's see. Hi.
Hello. How are
How
you?
are you?
Well, great, Sierra. I was so interested in your content on your Instagram just because of your background. So I just want to introduce myself, okay, to yourself and your audience, okay, because you have quite a large following and audience, okay. So my name is Dr. Ellen Wood. I am one of the reproductive endocrinologists, fertility specialists at Ivf MD. Our practice, we are in South Florida. We're one of the largest practices in Florida. Currently, we have 13 doctors and 6 locations with 4 in vitro labs, okay? So I am a doctor of osteopathic medicine. I have an osteopathic degree, and so I kind of was, let's say, raised in the philosophy of looking at, the whole patient, looking at every aspect of what's going on in the patient's body, the patient's life, everything. And that's the way we're trained. However, once we start to specialize in medicine, and this is, true of osteopaths as well as general medical doctors, what happens is it's like we start to narrow our focus. So we go from family physicians who learn the big picture down to, all right, we're OBGYNs, we're only interested in the uterus, the ovaries, and the pelvis. Now we're reproductive endocrinologists, and we don't really care about the pregnancy part of it anymore. We only want to get you pregnant. So we start to subspecialize and really start to like micro dissect things. However, this is good because it makes us good at what we do, okay? Because we just do it thousands and thousands of times over and over and over again. However, there's lots of patients out there that don't fit the regular cookie cutter mold, okay? I mean, they need you to look at what's going on here, what's going on here, what's going on here. And so, as we get frustrated with our traditional treatments, okay? Because again, I got lots of good tools in my, in my bag. I mean, I've got lots and lots of good drugs. I've got everything. Sometimes we have patients that it just doesn't work, and you're frustrated. You're just like, why doesn't this work? This should work. This worked on other people. And then you start to think out of the box and start thinking, well, what other things could complement what I'm prescribing, what I was trained in, what I am educated and board certified and know how to do? What else could I add to that? And this is where we started looking to acupuncture 15, 18 years ago. And we started looking at, I've recently over the last year or two started looking at, different aspects of holistic medicine. I've looked at functional medicine. And you're just like, wow, there is so much else that these providers can give to our patients. And what I was really impressed about from your perspective was you've been there. So you have a perspective on what fertility treatment's about. You're into looking at that whole aspect of the patient. And then, like, I thought what was really neat is that you can, like, you're coaching people through their pregnancies. You're actually coaching them through labor and delivery, and I worked with midwives when I was a resident, and I've worked with doulas. And then you're going into lactation. I mean, even encouraging these people, like, to breastfeed. I mean, like, breastfeeding was one of the most awful experiences of my life, but I stuck it out for both kids for 9 months. But I'm just saying, like, so I was really, really impressed, which is why I reached out to you and wanted to talk to you and just have your input for our patients. I have all sorts of little things I recommend for them, but for, how you could complement the traditional therapies that I have to give, which work great. But I do think that there is another aspect of looking at the whole patient and everything that they can give. So tonight, I'm on the IVFMD website. This is my practice. Again, I'm one of those 13 physicians. I've been there for 20 years. Scary, right? It is really scary. And then, so I'm on their Instagram page, and I also have my own Instagram page at Dr. Ellen Wood. So, Anyway, thank you so much for agreeing to talk to me about, this your aspect and your expertise. Could you introduce yourself to our IVFMD followers?
Absolutely. Hi, everyone. My name is Sierra Bazell, also known as Sierra the BB Doula. I am a 7-year secondary infertility survivor turned holistic health coach, herbalist, and doula. So I went on this journey to heal myself when dealing with my issues and then decided to reach back and help others. And that's really what I focus on. And I believe that, holistic practices can work very well with medicine. So I always encourage people to make sure that they are going to see a fertility doctor and finding out what the issues are and working together with them, as well as looking at the entire picture so that they can maybe heal some of those things and have a better chance at being able to be successful if they do need to do IVF.
Right. No. So I think that's, that was our topic tonight was, what kind of things. Now, what I have submitted, I think Shirley, our PR person has, sent you some of the questions. So what I wanted to address first before other questions come in, because sometimes they do when we do these type of live events. So I want to address the 6 or 7 questions that we've gotten beforehand. Okay. I'll give my take on them, and then you can give me your perspective as well. I've seen, interestingly, from some of the Tuesday takeovers that we've done, I've answered a question last week, and then one of my partners answered a question this week, and she had a little different answer than I had. But again, everybody has a different perspective as to what they've seen. So, when you've seen someone who has done too much activity, in early pregnancy, and they've started to bleed, and they've had a miscarriage, it really taints you in your mind to say, maybe people shouldn't do that, because my one poor patient, it happened to. So, even just one case, even though it may not be recommended, may have never happened to another practitioner, it does really taint your views. So everybody has different views on the advice they give patients, and most of them are based on practice. That's what medical practice is. And after doing it, again, I've been in this practice for 20 years, and I've been doing reproductive medicine for 23 years. So, I've seen thousands and thousands of patients, and I have my strong opinions on certain things. It's based on my own experience. So, one of the first questions that we had that was submitted, I think yesterday or this morning: do you recommend stopping occasional alcohol or caffeine for IVF? So, as far as alcohol is concerned, definitely routine alcohol ingestion has been shown in studies to lower pregnancy success. So we do recommend avoiding alcohol. My personal perspective is that moderation, okay? So I don't think, a glass of wine is going to kill your success. I think, a bottle every night, that's probably not the best thing. But, if you don't have to completely abstain, if you want to have a glass of wine, have a couple sips, but a glass, I tell patients 2 to 3 glasses of an alcoholic beverage a week, I don't think is really going to just destroy your ovaries or your success. But I do think that, daily alcohol ingestion, more than 3 or 4 drinks a day, or something that it can be detrimental. So moderation is key. And then caffeine, my personal feeling is I look at the animal data on caffeine. And when we look at caffeine, when we're looking at the mouse studies, okay, when we gave the mice the equivalent of a caffeinated beverage, we had no adverse outcomes in mouse IVF. We had no adverse outcomes in miscarriage or anything like that. Yeah, we gave the mice 12 cups of coffee. They miscarried, okay? They didn't do as well. And caffeine, what it is a vasoconstrictor. So it's, it makes your blood vessels constrict. And so when you have constricted blood vessels, when you stop drinking caffeine, people get headaches because their blood vessels aren't constricted and their blood vessels are big, they're bounding. Well, the same thing can happen to your ovaries and your uterus. So vasoconstriction happens all over the body from caffeine. And so therefore, I think, one caffeinated beverage a day is not going to cause harm. More than that possibly could. I think you really have to go over the top, but I don't think, to withhold one caffeinated beverage is especially if people enjoy that morning coffee, it's not going to affect your fertility dramatically. So what are your thoughts on these things?
Well, I agree with you as far as what the research has said. Clearly we see that if you indulge in things and you do it in excess, then it can cause a problem. So I would say definitely do things in moderation. But also, if you're eating a healthy diet anyway and you are taking care of yourself, then I don't see where having a cup of coffee in the morning is going to stop you from conceiving. And again, with alcohol, you probably, maybe if you want to cut it all the way out, then that's fine if that works for you. But there are people who drink and they are able to conceive. So just do things in moderation. Everybody's body is different, and we don't know how a person's body is going to respond. So you can't say to one person, cut it completely out, because it may or may not work for you.
I know. There's a large Italian study that looked at alcohol and it showed more alcohol got them pregnant faster.
Yeah.
I'm serious. That study exists. I mean, so that's, the studies, actually, the data is questionable. But I read this Italian study. I'm like, okay, well, we'll put that in the controversial category. But it does say if you were Italian, you drank more wine, you got pregnant faster. And you just have to think about that. Okay, so this is a question similar, okay? And it's, do you recommend male partners take any supplements if their sperm is optimal? I mean, I think if your your count's good and your motility's good and your morphology's good, I mean, I think for gentlemen in general, health, I think CoQ10 is good. I think antioxidants are good, but this is more for general health. Now, general health, improved health is going to play into improved sperm. So I do think that optimizing your diet with antioxidants, healthy fats, and again, there is a little bit of data out looking at just CoQ10. I mean, we know it optimizes male health, heart health, but I think potentially it could give your sperm an extra edge. But if your sperm's already good, I don't think any of those things would harm it. Okay. But if your sperm isn't that great, it might help it. But, so to take supplements, again, they're not going to hurt. This is just going to complement, hopefully, a good diet. Yeah. So what are your thoughts?
I'm always a proponent of trying to make sure that you focus more on your diet than supplements. Supplements to me are things that you take only after you've consulted your doctor, of course. But if you have an issue where you actually need them, I think that is when you should take them, as long as it's fine with your doctor. But if you're already doing well, I don't necessarily think that you need something extra.
Yeah, well, no, it's interesting. It's kind of like, I think where I've kind of pulled back a little bit on the supplements is kind of like, all right, well, you can't eat crappy and then just take a vitamin to fix it.
Yes.
Like, that's just not the way it works. Like, you have to focus into what are you eating for breakfast, lunch, and dinner. So if you're eating, poor diet, fried foods and fatty foods and foods with low nutritional value for those meals, you're thinking, well, I can eat whatever I want because I'm taking this super supplement. Like, it's not going to help. So I think we should use it as maybe a complementary factor, but I think primarily, healthy food should be focused on at every meal. And I think that's what fertility coaches do. And I really think that a lot of our patients, and the problem is, to me, it's always kind of been ingrained in my mind what's healthy. So I just think everybody knows this, because this has just been the way I've lived my life for the last, 53 years. I mean, I've been into just keeping myself, healthy. And so I'm just like, well, doesn't everybody know that avocados are good for you? Doesn't everybody know that nuts are good for you? Doesn't everybody know not to eat fried food? I'm like, and apparently this is not the norm, because now I have incorporated this into my children. So when they show me what they eat and what they make, I'm like, you've listened to mom, thank God. Like, they're in college and they show me their healthy meal with their avocado toast and, their protein and their asparagus, for dinner. I'm thinking, I feel so good that they're not eating, terribly well at college. So I think that as you've already stated, I think focusing in on diet first is paramount. And then if we're still having issues, yes, we can add, different antioxidant type supplements, but to focus on antioxidants from foods, I think is most important. What are your thoughts? What do you recommend to your patients? What key fertility foods?
So I'm always really big on making sure that you are eating not only healthy foods, but you're trying to stay away from things that are not always organic and natural, just because we know that you have the added factor of all of those hormones and we don't necessarily need those. So if you can afford to eat organic and natural, definitely do that. Stay away from fried foods and all of those good things. But things like berries are really good, avocados, nuts, and seeds. So almonds, walnuts, things of that nature are really good for snacks. Instead of picking up those processed foods, opt for some fruit and some healthy fats like nut butters, some nuts instead. And those are things that you can grab quickly and on the go. Have things like salmon, which is going to give you those omega-3s, and it's really, really going to be good for your body. Eat lots of vegetables. So those green vegetables, things like broccoli, kale, spinach, all those fun things are going to be great for you. Even asparagus, as you talked about before, can be really good for you as well. I like to tell people to eat from the rainbow. So, try to make sure that you have colorful foods on your plate, things that look pretty. Those are going to be the things that are good for you. And things like eggs, if you are into eating eggs, and chicken as well.
Yeah, I mean, it's just so fascinating. So I was like, I had exercised, and then I had to have breakfast, and I drove to my other house. It was 2 hours away, and so I was starving. So I ran into Publix. I was picking up some stuff, and I'm like, oh my God, I'm like, oh, protein shake. I pick up this protein shake. Okay, literally, there's a bunch of them there. I look around, I'm like, they had so many freaking ingredients in this. I'm like, I can't drink this. Like, I cannot drink this. So, I mean, if people are going to think like protein shakes are healthy, the label was scary. I'm sorry. Yeah. Like, you need to juice yourself. Like, you need to get a juicer, stuff it in the juice thing, and you need to know what comes out in this, because what you are buying in as a bar, protein bar, healthy. I mean, what you're buying in a protein smoothie, scary. I'm sorry. It's very, very scary. Whereas, again, I flipped it back in the ingredients. I looked at this one, like, I can't put this in my body. So anyway, I left the supermarket with some vegetables that I cooked when I got home with eggs. But I was so hungry. I'm like, I just need something to eat right now. And it just didn't happen. So, and the labels fool you. Like, the labels really fool you. They make you feel like you're eating something healthy. But when you turn it around and you look at like any ingredient that you can't pronounce, like what's in it, don't eat it. Like, don't put it in your body, because I don't know what it's doing to your fertility. Because the amount of male factor fertility that I see, so I started practicing reproductive medicine in 1997, and maybe 15 to 20% of our guys had low sperm counts. This is half my practice. Half my practice. We have nice looking, big, fit, normal looking guys, okay? And they come in with their wife. I've been trying for a year. You've never, like, that's not him. No way. Like, he feels fine. He has no issues. And you get his sperm back and you're like, wow. Like, what the heck? So definitely there are environmental poisons out there that we are just like reading the labels and unfortunately getting poisoned with. It's quite sad. So people really have to be aware. Again, fill your plate with a rainbow. If you can do organic, that's the best. If you can't do organic, it's still better than not doing it. It's still better than not eating fruits and vegetables. But anything that has all this crap in the little label, just don't put it in your body. It can't be good for your sperm. It can't be good for your eggs. So the quick question here I will just address so I don't lose it on the little feed thing. How does overweight impact fertility? So the interesting thing about being overweight, okay, we look at BMI. And so when your BMI is over 35, okay, which is a lot of our patients, unfortunately, we just know you don't do as well. And we're not saying if a BMI is over 35, you can't get pregnant. There's lots of women that get pregnant without fertility help, just have sex and get pregnant, okay? But it may lead to overweight in your baby. It may lead to long-term medical problems in your baby. So being overweight can have a long-term impact, not only on you, but on your family, on chronic health diseases, diabetes, hypertension, heart disease, all sorts of terrible things. But from the fertility perspective, as a specialist, if your BMI is over 35, I said, look, I don't want to transfer your embryo. I know your miscarriage rate is higher. I know there's a less chance that you're going to implant. So if you can lose just 5% of your body fat before I transfer you, your embryo's frozen. It can stay frozen. Focus on that. I mean, especially in a state like ours, I don't know about South Carolina, but I mean, a state like Florida, a lot of people who do fertility treatment are paying an enormous amount of money out of pocket for this. So if you're paying an enormous amount of money out of pocket for this, okay, let's optimize success. I mean, I'm just not in it just to throw your embryo back in and say, yeah, it worked, it didn't work, okay? No, success is my goal. Like, success is always my goal. So to try and have you take 3 months, take 4 months, work with a fertility coach, work with someone who's going to be there with email, with diet, with tips, with support, who's going to be there for you and just because again, everybody falls off the wagon. Everybody just needs that like extra push, like just, to say, no, don't buy that. Like, it's like, don't go to the supermarket hungry. Like, no, I need to make sure I'm having my salmon tonight with my broccoli. And I need to make sure that, I'm trying to optimize my health because I know that in the long run, and it may only be 3 months, it's 3 months that we have to do this. And then once you're pregnant, it's a no-brainer. Okay, I want to ask you, Sierra, have you ever had a pregnant patient, okay, who has said, no, I want to eat crappy during my pregnancy? like once you're pregnant, you want to make sure that everything you're taking in, it's going to help your baby because now it's your baby. But when it's you,
Yeah.
I mean, people really focus once they're pregnant, but to get them to focus pre-pregnant, that's where the baby health comes in. So I think that's super important. I mean, again, I have patients who come into my office and they say they smoke. And I like look at them and I go, really? And I'm like, okay. And I explain to them, there's only 3 things that can affect your God-given supply of eggs. Okay? Number 1, having an ovary taken out. Boom, half your eggs gone. Number 2, chemotherapy. Women who undergo chemotherapy for breast cancer, 60% of them will be menopausal after chemotherapy. Chemotherapy is poison that kills cancer. Also, it's poison that kills eggs. Third thing, tobacco. Okay? Tobacco, it will put women, if pack-a-day smokers over 20 years, put them into menopause 6 years earlier than women who are non-smokers. Okay? 50% less IVF success rate. So don't come into my office and tell me you smoke and tell me you're not going to quit. Because I am not going to do fertility pills. I am not going to do IVF. I am not going to treat you for fertility until you are 6 to 8 weeks tobacco free. It makes no sense. It makes absolutely no sense. So I have a huge soapbox with the tobacco, and I've gotten a lot of people to quit. I had one lady last year, like literally she quit. She was pregnant. After she quit 3 months, she was pregnant on her own. Like, I was like, wow, that's so cool. Because there's so many other things that smoking does besides just kill your eggs. I mean, the motility in your fallopian tubes decreases and things like that. So when I say to a patient, I go, look, so if you don't want to quit smoking now, will you quit smoking when you're pregnant? And they're like, oh, of course. Absolutely. Like, well, why not now? So same thing with eating healthy. So your thoughts?
Yeah, as far as BMI is concerned, I would definitely agree with you because once you do conceive, if you are overweight, then we have to worry about other issues in pregnancy. So it's more important that you start off healthy so that then we don't have all of those issues. So, it would be very, very helpful if people could definitely focus on losing some of that weight and choosing to eat better and making better choices in general so that once they do conceive, we don't have to worry about things like preeclampsia. You can reduce those risks by the way that you eat and the way that you take care of yourself. Also, gestational diabetes and other issues for yourself and the baby, such as preterm labor. So we want to make sure that we're taking care of those things early so that we don't have to worry about it later.
Yeah, we have we have nutritionists who are on part of our staff, and they work with our patients. I mean, they have their own, like, they have had patients, so we've said, hey, look, we don't think you're healthy enough to get pregnant, go see our nutritionist. They go see the nutritionist, they lose 5% of their body fat, they get pregnant without our help. It's like, okay, now we're like killing our own business, but
yeah.
But I'm just saying, it's amazing how, when we have that tiny reduction in, I mean, it's not a lot. We're not saying, hey, lose 100 pounds here, but with that tiny reduction in body fat, how people's bodies and their ovaries start to function so much better. Really, really just, and we literally, I think now we probably have hundreds and hundreds of patients, because we've been focusing on this in our practice for, at least 4 or 5 years, maybe more than 5 years now, on saying, hey, look, you need this treatment, but not right now. Like, you need this treatment, you need to get healthy, and then we'll do this treatment, because we're more likely for it to work.
Right.
All right. So we have another question here. Have records for fertility testing from the last 12 months. Does IVFMD accept them? Yes, we do. So we have certain, that's an easy one. So we have certain tests that we need repeated every 6 months. And then we have certain tests we need repeated every 12 months. So like hepatitis B, C, syphilis, HIV testing. We do like to recheck thyroid and prolactin levels every 6 months. So there's certain things that are 6 months and certain things that are 12 months. We will review any records, even if they're 1 year, 2 year, 3 years old, and recommend that they get changed, that, they get repeated. Now, certain things won't change, like genetic things. If you had just testing for cystic fibrosis and spinal muscular atrophy, these gene diseases, they're not going to change. But yeah, we absolutely accept any records, and we do free second opinions. We do virtual, free second opinions, all that stuff, all of our docs and all of our locations. So yeah, this whole pandemic thing is just like really opened us up to, talking to people all over the country, reviewing records, just kind of giving them an idea of, hey, a fresh eyes, fresh perspective. And I even encourage patients that I've had, very difficult journeys with, and I'm just like, look, I need another set of eyes. And we have a big enough practice that I'll say, hey, go see this doctor in our practice, or go see this doctor in our practice. Because again, we all have, little different things that we look at. But I think this day and age of this, the ability to do virtual, the ability of Instagram to do direct messaging, to look in and get advice on all sorts of, things has just been kind of, you have to look at the silver lining in this crappy time that we're in. And I really think it's been very, very helpful for patients. All right, so we got another question from the same patient. How should I prepare for the IUI process? Questions to ask during initial appointment. So questions for IUI, again, I'm sure if IUI is recommended by your doctor, we're dealing with a borderline sperm count. So we're looking at sperm that aren't perfect, but aren't god awful. And we think we're going to be able to achieve a decent total motile count in order to inseminate. So I would just make sure, ask the clinic how they time your inseminations, because clearly once you ovulate, there's only a 24-hour window that your egg can be fertilized. So we have to make sure that they're putting in the sperm at the proper time. So that's one of the biggest things with IUI. Are my sperm adequate? Do we think I'm going to have enough for IUI? And how do you guys time my IUI? Because timing is key for that process. What are your recommendations for IUI?
Well, I think that you pretty much covered everything with IUI. I would just like to ask a question there, because I know that people may not know what the difference is between IVF and IUI. Do you mind explaining that just a little bit?
Okay, so what IUI is, it's basically where we take the sperm, we're going to wash it, we're going to separate out. Okay, so when sperm are ejaculated, what we get sperm and we get semen. And in the ejaculate, the sperm and the semen get together. So you can't put semen into a uterus, because what semen has in it is prostaglandins. Prostaglandins cause cramping of the uterus. So we can't just take an ejaculate. So a guy ejaculates in a cup. We can't just suck it up into a catheter, put it into your uterus and squirt it in. Okay, because you will not be happy. Okay, so what we have to do is we have to wash the sperm. So we have to put it with a special wash, and what the wash does, it spins the sperm and it separates out the live from the dead sperm. The dead sperm floats to the top. The live sperm, not the semen, just the sperm, will float to the bottom of the test tube. Then what we do is we take that pellet of live motile sperm, which is about 0.3 cc's in volume, and then we take a very tiny little catheter and we place it directly into the uterus, okay? And so that is done in our practice. We do that just prior to ovulation, and then we do it again after we feel you have ovulated. So it's kind of like a sperm, egg, sperm sandwich. And so it's a low-tech procedure. It is not expensive. Most clinics, we charge $400 or $510 for $9 for it. Some clinics will charge $500. I think that the most expensive I've heard is $650. But it's usually a very inexpensive type of procedure. Again, we do it twice just to optimize the amount of sperm when the egg is there. Sperm should live for up to 3 days. So, you know, we have sperm, put them in there, they should be alive, but if these guys didn't get it, or if your sperm aren't as strong and they can't live for 3 days, then we put sperm in on the backside. And so again, it's just like millions and millions and millions of sperm just trying to find that egg. Unfortunately, success rates aren't what you would think they were, because a lot of people think like, oh my gosh, here's my egg, here's my sperm, like I have to be pregnant. Like I saw the egg on the ultrasound, they put the sperm in, I have to be pregnant. The success rates on average only run 10%. I mean, it's 1 in 10 patients will get pregnant, but it's better than zero. And you're not spending $20,000 to $25,000 on IVF. So it's one of the low-tech interventions that if, you know, the wife has a good ovulation and the sperm are just a little borderline, they need a little direction, it's a really great treatment. And again, I have, thousands and thousands of patients that have gotten pregnant with it. So I like to try it first. I mean, we're not going to do it 6 times, okay? The most I'm ever going to do IUI in a patient is maybe 3 if everything is perfect. Good ovulations, good sperm samples. We all acknowledge, okay, even insurance companies, that IVF is more efficient, okay? IVF can yield success rates in the 65 to 80% range. However, it's a much more involved process. It's much more expensive. There's so much bigger commitment than you have as to coming in and getting sperm washed and squirting it in. There's no restrictions on IUI. You get the sperm squirting and go back to your day. You know, you have your 2-week wait. I mean, there's no restrictions. IVF is very, very involved. So what this involves is going to be stimulating a woman's ovaries with injectable fertility medicine, not fertility pills, okay? Not natural cycle, but injectable fertility medicine, which usually costs about $5,000, okay? The fertility pills I'm talking about, $10. So again, big difference. But a woman is going to be injecting herself with fertility hormones for approximately 10 days, average. And then she's going to have 5 or 6 ultrasounds. Then she's going to undergo a minor surgery that requires some conscious sedation, which is a little bit of anesthesia, and we take out her eggs. Her eggs are then fertilized in the laboratory with her husband's sperm. Either we're doing natural fertilization, which is take the egg, plop the sperm on top, hope they fertilize, play some soft music, put them in the incubator. Most of the time we will do that if the sperm look great, but 75% of our cases, we take the egg, we take the sperm, and we put it right into the egg. So we make sure fertilization occurs. So it's a little bit more of like a sure thing, you know, that fertilization is going to occur. Now we need to grow the embryos for 5 to 6 to maybe even 7 days in the lab. So here's the way we get them grow. Some of our patients, we will replace their embryos fresh. However, the majority of our patients would like us to actually test their embryos and identify, is their embryo healthy or not healthy? Because we can take a teeny little sample of the part of the embryo called a trophoblast that's going to make the placenta, take a few cells off of that, and then send it to a genetics lab. In 2 weeks, we'll find out, is your embryo healthy or not? Because pretty embryos, unfortunately, don't equal healthy embryos. Okay. I have seen the most gorgeous Down syndrome embryos, and they're beautiful, absolutely beautiful, but they have a genetic problem that is not going to result in a healthy baby. So beautiful embryos, unfortunately, can have extra chromosomes, which will lead to an unhealthy pregnancy and a miscarriage. So it's a much bigger procedure. It takes a month of prep, 2 weeks of IVF treatment, 2 weeks of waiting to see whether the embryos are healthy. And then once you have healthy embryos, it's another month of prep, evaluating the uterus, evaluating your body, and then we need to prime your uterus to receive the embryo. So IVF is going to be a good 4 months minimum of your life, okay? But the success rates are 65 to 80%. I mean, it's like super, super successful. Okay, IUI, we squirt some sperm in. I mean, so that's the difference between the 10% and the 65% success is, so it's the amount of time commitment, and we're talking maybe $1,500 for an IUI cycle not covered under insurance versus $20,000 to $25,000 for an in vitro cycle. So it is kind of a night and day type of thing. And again, some people, if you have a severely low sperm count, if you have no fallopian tubes, then IVF is really what you need. But if you're kind of in that like borderline care, well, I don't ovulate that great, we give you a fertility pill. Well, my sperm are so. I mean, I think IUI is definitely a treatment that can yield success, or we wouldn't do it. When nobody gets pregnant, I mean, come on, we're doctors. We're not just trying to take you through the motions. I mean, hey, we want pictures of the babies on our walls. We're not in this just to go through the motions. We're in this to do that OB ultrasound. And I mean, I did a great OB ultrasound today. I mean, these people have been trying for like 5 or 6 years, and like literally, like the husband, when I showed him the heartbeat, he was in tears. Like the husband was in tears. It was just like, it made me teary. I mean, like, she's like, look at you. You're more teary than me. I looked at him like, oh my God, the man was like, he was like literally crying in the room, which made like me cry, because it was just, the heartbeat was just so beautiful after everything this couple had been through. So that's what I do it for. That's what I get up every day for. That's why I go to work. Like I want that outcome. So I'm not going to try to put you through a fertility treatment, like just to go through the motions of the whole thing. I mean, I want it to work, but I don't want you to go broke. So if we think that an IUI cycle, could be appropriate, I recommend trying it. I mean, again, I don't do it ever more than 3 times really, but I think it's definitely a treatment that a lot of people can benefit from. All right, you want to add to that? Sorry, I was long-winded there.
No, we have a question. What treatment would you recommend for someone age 44?
Again, that is kind of a loaded question, okay? Because it depends. If you are 44 and you are single and you have never tried to get pregnant before, okay? We may squirt some sperm in there the first time and you'll get pregnant, okay? If you're 44 and you've been trying with your husband for 10 years, that's a completely different story. So we have to quantify 44-year-old single, single woman by choice, wants to have a baby. You are not infertile. Like, you could get pregnant, just pick some sperm, as opposed to someone who, hey, I've been with multiple different partners over the last 15 years. I've never used birth control and having a pregnant. Completely different story. So the age, yes, we take it into consideration. And we do know that natural fertility declines as you age. Starts to really plummet at age 35, okay? But there is no way I could ever tell any woman at 44, just because you're 44, you couldn't have a baby. Like, that's just not true. It's just not true. So again, this patient is trying for a year. Again, hopefully you've been evaluated. If you've been trying for a year at 44, you need to be evaluated like yesterday and find out, is there a problem? Because there's stuff that you could do that could improve your natural fertility. And then, once we start to get into IVF type stuff, fertility rates decline. And at 44, I mean, IVF just kind of sucks. I mean, it doesn't work great. I give patients to 43 and rarely I have I have a handful of successes at 43. And my personal success rate out of this is 1997. I have one patient at 44 who's had her own baby. So that's with your own eggs. Now I've got gobs and gobs of patients in their 40s who get pregnant. Unfortunately, they have to give up the dream of using their own eggs. And so we treat patients up till 48, 47 and a half, 48, using eggs from a younger woman. So it's not like a 44-year-old can't get pregnant. She absolutely could. I mean, we have, again, Oodle, like I have a patient now who's, you know, she's 50, almost 51, and she's pregnant with her second baby, but we let her do it because she had her first baby with us. And, you know, so if you're healthy, you can be pregnant technically at any age. I mean, we try to cut it off. But again, obviously the dream and the goal is to use your own eggs. So clearly that's the number one thing we're going to look at. What's the potential of your own eggs? You know, what's the issue? We give you realistic based success rates, you know, and then take it from there. But I definitely, if you've been trying, get evaluated yesterday. Okay. Okay, you can comment on this one. Supplements versus IV vitamin therapy. I am not well versed in IV vitamin therapy at all. Like, that is just not my thing. So do you have any thoughts on it?
I think it again depends on the person and why they're using supplements versus vitamin therapy.
I mean,
so
IV iron, I've recommended many patients for IV iron because the oral stuff they can't absorb.
yeah.
But that's my only exposure to it.
Yeah, I mean, there are lots of different IV vitamin therapies out there. People like to go see holistic practitioners who will do these different types of therapies to try to help people when dealing with different issues. But it would depend on the issue and why you're using it and what exactly you're trying to accomplish. So in this case, I would need more information to be able to give you a better answer. I'm sorry.
Yeah, well, I think a lot of when you're talking about IV stuff, we're talking about absorption. So say you have a gastric bypass, okay? And we have lots of women, wonderful, they lose 100 pounds in gastric bypass. I've had multiple just pregnant, like they've had infertility issues, they get a gastric bypass, they lose 100 pounds and they get pregnant on their own. I know I have the stories on my walls. So I think IV vitamin therapy in patients with poor absorption, I think it can actually help. But that's really the only, thing that I would think about it.
Okay, so this person says she saw a fertility nutritionist and she recommended loads of supplements, but I have a hard time swallowing pills. So some supplements, as the doctor said, can be given to you through, IV. I'm not sure if all of them are available in that way. Do you know if...
It depends. I mean, it really depends on the vitamins. We usually draw a blood test, see if you're deficient. If you're deficient and you can't absorb it, and we're giving it to you, you can't absorb it, you can't swallow it, we'll give it to you through IV. I have one patient who the woman cannot swallow anything. We even had to give her liquid iron. She's vegan.
Wow.
Okay. And B12 deficiency and iron deficiency rampant in vegans. Like they're all deficient. They're all of them. I haven't tested one that hasn't been deficient. And they're like, I eat so healthy. And you just look at their blood, you're like, ugh. Like, no vitamin D, no ferritin, no B12. And what she did, we actually have a supplement we use. It's an over-the-counter company. It's called Coast Science. And it's just specifically has nutrients in it. It has CoQ10, PQQ, resveratrol, pyrinositol, quadrifolate in it, but it is a capsule. And what she did was she actually took the capsules, opened them up, and dumped the capsules in a smoothie that she took for 3 months before I did her IVF. Okay? Crappy AMH level, okay? Embryos, beautiful, 3 normal embryos. She has a beautiful 1-year-old right now, 2 left in the freezer. I don't know whether she'll go back and get them. She has 2 kids now. But I mean, when I told her, like, I really want you to take these supplements because your AMH level is low and blah, blah, blah. She's like, I can't take pills. Okay, let's compromise. Let's think. And so, I mean, let's think of an alternative here. And we said, let's see, because a capsule, you can pull the capsule apart. You push it in the smoothie. She drank one of the smoothies every single day, 3 months before her IVF. I don't know whether it was that made her do great. She did great. She has a baby. Like she has extra embryos. But that's the way we kind of got around that. She needed iron. She was also severely iron deficient, and we gave her liquid iron drops, which brought her ferritin level up. So, I mean, that definitely helps. So there's definitely different alternatives that you can consider to try and, get the nutrition into your body. And again, I recently had another lady. This patient said she had low AMH level. I mean, this patient of mine, I first IVF cycle was crap. All of her embryos died in the dish. I've had her on. She's been on vitamins for a while. I said, let me change this around. I changed things around. Her results just blew me away. Okay, 5 eggs, 4 embryos biopsied, 2 healthy. AMH of 0.3.
Wow.
Like, I know. I'm like, when I got there, I'm like, wow, AMH of 0.3. She has 2 healthy embryos, boy and a girl. Couldn't get luckier than that. But from 5 eggs, 5 eggs. That's all I got. Like, and we've really, tried to boost her up, her nutrition, her lifestyle, blah blah. I mean, the first cycle went crappy, but I changed a few things around, and then we improved. But yes, I mean, I think this patient just said she'll try the capsules. But yeah, try that. I mean, I don't have a ton of patients who can't swallow medicine, but this one particular patient, that's what worked for her, and I saw the results. I don't know whether this caused this, but she didn't do as well in her first cycle. She did this 3 months before her second cycle, and I was really happy. And her baby's super cute.
Yeah. I think that's a great set of advice, because again, you can crush the pills up even if they're not in capsule form. You can always try that, crushing things up and adding them to your smoothies, as well as trying to find liquid supplements as well. So I think that
but I think it's I mean, obviously, as I go back to, I started off food is medicine. So food is first. Food is first, supplements are second. But again, I listened to a podcast on whatever the stuff is they have in pomegranate. Okay, pomegranate's supposed to be some sort of superfood. Apparently, you can't eat enough pomegranates to get enough to support you as this one super supplement this guy invented. But I mean, like, there's just no way you can do it. But again, the antioxidants and the pomegranates are, supposedly amazing. But what he invented in his supplement thing, I was like, oh, interesting. I mean, I was looking at the science of it. I was, curious about these things. Okay, a couple more questions here. I said, going into IUI after 2 years of trying to conceive, 1 miscarriage, 2 plummet cycles, should I just do IVF? Again, it depends on your age. So age is key here, okay? So if you're under 35, try an IUI. Up to 37, I try an IUI. I'm still a little biased. I try an IUI. Many of our doctors in our practice would, disagree with that. And some of the insurance companies actually would disagree with that. I saw a lady the other day. She's over 35. Her insurance company will not pay for IUI, but they will pay for 2 IVF cycles because she's over 35. And I told this to the couple who worked them up. There's really not that much wrong with them. I said, I'd like to try an IUI cycle. And I said, your insurance won't pay for it. They'll pay for IVF. And they both looked at me. They're like, I'm kind of not ready for that. Like, and I'm like, I said, I think it's a little radical, but, if you want to try an IUI, you'll have to pay out of pocket. And they're like, we'd like to try one. I said, okay, let's try one. So I'm a little biased. The sperm look okay. I would recommend you try at least 1 IUI cycle. And if it doesn't work, fine, go to IVF, because it's going to give you your best bet at having a baby. With this question, clarify, from the time of egg retrieval to testing and implanting can take up to 4 months. Yes. Okay. Let me just say this again. Okay. So this is the 4-month period of time. It's usually 1 month of prep, on or off birth control. Okay. So in the prep, we evaluate your uterus. You have an IVF consultation with a nurse. You get a calendar. You have an injection class. There's a whole bunch of stuff that has to be done in this 3 to 4 weeks. And then you get a calendar. The calendar will say, all right, you started birth control pills, say the 1st of December. Let's stop birth control pills the 21st of December. Let's start your stimulation the 26th of December. You're going to take injectable drugs from on 26, 27, 28, 29, 30, 31, 32, 1, 2, 3, 4. Okay, so you're going to be in on these 10 days, 5 times for monitoring. 3 days of drugs, blood and ultrasound. 2 days of drugs, blood and ultrasound. So it's 10 days. Now we're up to January 4th, 5th, 6th. Okay, your follicles are ready. Boom, trigger you. Eggs are ready. I take your eggs out 36 hours after that. Your eggs come out, We fertilize them in the lab. Now, your husband gives sperm, we grow them for 6 days, okay? So now we're into 4 weeks of prep, 2.5 weeks of growing. They grow for 6 days. I biopsy them. I freeze them. 2 to 3 weeks to find out if they're healthy. Don't know why it takes so long, but I'm not, all of our labs, we use 2 different labs, and it all takes 2 to 3 weeks. So it's like, no, we wait. You have a healthy embryo. We go back and do the same thing. We have to do a frozen embryo transfer consult, make you a calendar, get you a date, order you medications, teach you how to do it. So that takes 3 weeks. Then we start you on estrogen, thicken up your lining. Once your lining gets thick enough, okay, we start your progesterone, we thaw your embryo, we put it in, and now it's 10 days of waiting. It's 4 months. No matter, I mean, we can't make it really any shorter than that because of the making the embryos, testing the embryos, prepping the uterus, putting it back, and waiting. So yeah, it's a long time, but it's extremely successful. So you know, that's why we do it. But we just try to give people, you know, reality, because when they're going to expect the pregnancy test and when they're going to expect to have their kid in their arms, basically. I mean, I tell this to people sometimes, and they look at me like, so I'm not going to actually have a baby for another 18 months. Well, yeah, that's about that. Yeah, depending on what they need to do. Mm-hmm. At age 44, success rates are so low that donor egg is my only option. I didn't say that. I didn't say that. We evaluate patients at age 44 with their own hormone levels. Age 44 IVF success rates are quite low. Okay, they're running 3 to 5% with the best hormone levels, okay, and less than 1% with lousy hormone levels. Mm-hmm. Donor egg success is going to run anywhere between 65 and 80%. So I don't say it's your only option, but it's your best option, okay? We still do sometimes consider patients with excellent hormone levels at 44 to try. It's just the results are not the greatest, and if you're paying out of pocket, we have to look at resources. Okay, so I do take that into consideration.
I think all people are different. I've seen people that are 44 who have amazing hormone levels.
Right, they have amazing hormone levels. And they get
yeah.
There's one OB/GYN in our area who literally in 20 years, the woman has never sent me a patient. Okay? She got pregnant on her own at 42 and again at 44. Like first try. Okay, doesn't believe in fertility specialists. Like, again, but you get pregnant on your own, that means like everybody can. Like it just it makes you feel that everybody can. And this is the way I felt. So I'm going through residency. Okay. So I do my residency, I start my residency, and OB/GYN residency, first year, babies, and babies in the hallways, babies here, emergency C-section. I mean, it's just, I delivered hundreds of babies in my first year. Second year, and all you do is you go to clinic and you talk to people, birth control, and you're pushing birth control pills and you're pushing depot shots, you know, and you're teaching about the patch and you're putting in these implants. I mean, and you're doing all this stuff to help people not have babies, okay? Then I was 28 years old. I go, and in third year OB residency, you go and you do infertility. I go to infertility, I go, like, I wasn't going to have babies till I was 36 or 37. Like, that was my plan. I did my infertility rotation at 28. I came home and I told my fiance, you know that plan that we had? We changed the plan. But I mean, and I literally, I mean, I did fertility treatment for both my kids. Thank God, you know, it worked, and I've got my 2 kids. But I'm not sure if I waited whether I would have my children. Like, I really don't. But most people don't realize that it can be an issue, because when all your friends are having babies, no problem. You know, most people don't realize that 1 in 8 couples are having problems. I mean, it's now with social media, it's getting out there, but before social media had this, you know, platform and all this information out there, this was like a secret thing. So, I mean, I think this has just been so helpful for people, just raising awareness. Ways to reduce inflammation prior to IVF. Well, depends what the inflammation is caused by. And so if the inflammation is caused by infection, we usually use antibiotics, but anti-inflammatory diets, I think, are very key. I think optimizing vitamin D in the 40, 50, 60 level, I think is optimum for decreasing inflammation. There's so many things that can cause inflammation, but antioxidants, super healthy. Again, avocado, olive oil, coconut oil. Like, there's so many anti-inflammatory types of foods that I want you to expound on a little bit, Sierra, before our time is up. But I think, again, starting back with diet for anti-inflammatories is super, super, super important.
Absolutely. So when we're looking at diet to reduce inflammation, you're going to want to focus on those things we've talked about already, taking out those fried foods, those processed foods, the things that are not going to be super healthy, like a bunch of sugar. Sugar is very, very bad for inflammation.
Sugar is the sugar. Okay, the way I describe sugar to my patients, it is sandpaper for your insides. Okay. So think about your entire, like just your inflammation. Sugar is the evil to inflammation. If you can get rid of sugar, just sugar and processed sugars, any type of sugar in your diet, which aren't in vegetables, which aren't in proteins, which aren't in eggs, which aren't in cheese, there's no sugar in them, okay? Your inflammation will go away.
Yeah. Yes. So eat those healthy foods, eat those organic foods if you can. If not, just make sure that you're eating a whole food diet. Basically, if you leave it out and it will go bad, those are the things that we want you to eat. Things that come out of the ground, things like nuts and seeds, those things that are colorful, lots of omega-3s. If you like fish, eat lots of fish. That's very good for reducing inflammation as well. I would encourage you. She said, I'm diabetic. So yeah, that's even more reason to stay away from sugar, processed foods, and those things that are going to be high on that glycemic index. You may want to look at some of those things as well. That would be my recommendation.
All right, so I got a couple more questions here. I just want to kind of throw them in. IUI was on my cycle day 19 with a 21 millimeter follicle. Should I be concerned? Okay, to me that sounds excellent. Okay, my 21-year-old is a day 23 follicle that was only a 19 millimeter, and she is in graduate school right now. So again, I don't think that the day of your ovulation really matters. The size of your follicle, yes, we like it 19, 20 plus. So I wouldn't be concerned. I'd be hoping that if the sperm were good with your IUI, that you're pregnant. And then I've got another quick one here. My husband has anti-sperm antibodies. Is there anything he should do before we start? Anti-sperm antibodies are really, really difficult because if they're stuck to the sperm head, your sperm are not going to get into your eggs, and you're going to need to talk to your doctor about IVF. So I think that sperm antibodies are definitely a very, very difficult type of thing to handle, especially with trying to get pregnant naturally. So that's definitely a conversation you should have with a fertility doctor and determine where the antibodies are. So that's, I think, the last question. There was one other quick question here. Can hormones cause a cervical polyp fibroid to grow, and would you recommend removing it? Cervical polyps, they can stay. They're just more annoying. They cause bleeding with intercourse. Cervical fibroids, they can be pretty darn dangerous, and they are very difficult to remove. Trust me, I've been there, done that. It's a very dangerous surgery. But yes, hormones cause polyps to grow. Estrogens cause fibroids to grow. Estrogen cause polyps to grow. If they look like they're distorting your cervical cavity, your cervical canal, if you're having severe bleeding, if you're having distortion of your uterus, yes, both fibroids and polyps should be removed. So I think I got to all the questions that were pre-submitted. Hopefully we got to all the ones that were asked, and hopefully we answered them for everybody. And Sierra, this was so great. Thank you so much for your input. And I just want to tell all of your providers, I'm Dr. Ellen Wood. I'm at Instagram at Dr. Ellen Wood, Dr. Ellen Wood. And all of our IVFMD people, you are available. I looked through all the different programs you have. If you could just quickly shout out to our, all of our followers, what kind of services you can provide, because I know you do all of this virtually, and what support you can provide for them before, while they're trying to get pregnant, during their pregnancies, and definitely, your maternity services.
Absolutely. So I help people with trying to conceive. I'm a fertility coach. I help you look at all these things that we talked about today and work with you and your doctor to come up with a plan that works for you. I help people during pregnancy to make sure that they are having a healthy pregnancy and that they are taking good care of themselves. And I am there to support them during birth and as well as during their lactation. So if they have questions or they need some type of lactation education, I am there. So you can find me at Sierra the BB Doula right here, and click the link in the bio if you have any questions or you need to talk to me. Thank you so much, Dr. Wood, for joining me. This was amazing.
Yes, thank you so much. It was so much fun. Again, I'm so glad you could give your information to our followers. And have a great evening and a wonderful holiday season.
You too. Thank you. Bye, guys.
All right, good night.